Overall, 5,002 individuals have been tested for COVID-19, and of those tested, 663 tests are pending. I will now share the most current case counts. There are 42,110 confirmed cases of COVID-19 in Canada and 12,879 cases in Ontario. Chatham-Kent has 40 cases, and Sarnia-Lambton has reported 159 cases. Michigan now has 35,291 cases, and Detroit has 8,317. Today, we are reporting 541 cases of COVID-19 in our community, an increase of 16 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both residents and staff. 122 cases have been resolved. 29 people remain in hospital. 17% are between the ages of 50 and 59 years, and 23% of our cases are 80 years and older. 39% are male, and 60% are female, and 1% is unknown. Our community has lost a total of 35 people to COVID. 24 deaths have occurred among residents in long-term care and retirement homes. Our health unit continues to work with 5 long-term care and retirement homes that are currently experiencing a COVID-19 outbreak. Testing for COVID-19 is based on a clinical assessment. Symptoms include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, please complete the online self-assessment tool or contact Telehealth Ontario or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. Windsor-Essex has 2 assessment centers, Erie Shores Health Center Healthcare in Leamington and Windsor Regional Hospital Ouellette Campus in Windsor. Please note that testing is available for people who have symptoms of COVID-19. As we go into the weekend, please remember to do your part to fight COVID-19. Stay home, leaving for essential trips only, such as groceries or medicine. Maintain a 2-meter distance from others, cough into a tissue, and wash your hands often with soap and water. And a final note today to thank our essential workers, our healthcare workers, first responders, those who continue to maintain our food supply from farm to table, and those who continue to provide us with electricity, water, and gas. We appreciate each and every one of you. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As you just heard from Teresa, that we are reporting additional 16 cases in our community and 3 additional deaths. A female in her 90s, 2 female in their 80s, all positive for COVID-19, passed away yesterday. 2 of the 3 individuals were residents in long-term care. Reporting these numbers is not easy. Every death is a tragic loss for our community. Every life lost is not just a statistics, it is a person, a loved one to someone, a mother or a grandmother, father or a grandfather to someone. The WECHU shares its condolences with the families who have lost their loved ones. As we continue to see some of these deaths in the community and more cases, we also have some encouraging news too. We were able to rescind the COVID-19 outbreak from Franklin Gardens, one of the long-term care home, and we are looking forward to rescind outbreak in all of the other remaining facilities and prevent introduction of COVID-19 in any other facilities. I will now move on to our epidemiological summary for our region. So very quickly, once again, this is what we will cover in the presentation. I will focus on the key points to answer some of the questions that everyone, including myself, is asking. The conclusion that we draw is based on evidence, and the data that we collect will help us, or is already helping us in making evidence-informed decision-making and to make our public health recommendations. The epidemic curve or EpiCurve help us assess the progression of the disease, whether in the community or in an outbreak situation. This particular EpiCurve is created to show the confirmed number of COVID-19 cases by symptom onset date. On your vertical axis, you have the number of confirmed cases, and on the horizontal axis, we have the dates that these cases started showing symptoms. This includes all the cases, that is cases in the community and cases in the long-term care home and retirement home. Please note the right-hand side of the graph contains data which may not be complete at the time of reporting, and we're still in the process of collecting that data. This particular EpiCurve is created to show the number of confirmed cases of COVID-19 in the community and the number of cases in the long-term care home and the retirement home. On your vertical axis, you have number of confirmed cases, and on the horizontal axis, we have the dates these cases were confirmed. As you can see in the blue bars, the cases in the community showed a peak around March, and it's now in the downward trajectory, and we hope that it will continue this way. A word of caution again, the last section of the graph, on the right-hand side of the graph, still may have data that is still yet to be reported, so we'll be updating as we continue to get more information. So the next logical question always comes to our mind is, when we are looking at these cases, where are we compared to some of the other communities and compared to the province? Is it something really bad, something we should be worried? We looked at the regional and provincial rates per 100,000 population to standardize the comparison and make the comparison more reasonable by adjusting it based on the population size. This data is adjusted only on the population size, and it's not adjusted based on the distribution of various age group in the community. Some communities may have more seniors, some communities may have less seniors population, and it changes. So this data is just based on the population standardization. When we are looking at it, we can see that we are significantly high rate compared to the provincial average. But on the same note, if you're looking at the comparison from the province have a senior population of roughly 16% of overall population. In our community, it's 18% or higher. So we can see the difference in Lambton County. Also, this population of senior is significantly high, close to 20 to 21% of their population size. The next question that comes to mind is about how about the testing? How many people are being tested every day? And among those who are tested, how many of them are coming back positive? This is an indicator to show how prevalent the disease is in our community. And if more people are being tested, and a lot of them are coming back positive, that means we have a problem. But on the flip side, if you look at the number of tests that are coming back positive, is dropping all the way from 20% down to closer to 5% or less. And I would just again caution the last section of the graph, that because of the delay, we may see a difference and then suddenly a spike in the number of positive cases. It's just because of the function of the testing delayed. So I would just keep it as a caution that yes, the percent positivity is going down, but it hasn't gone down to that level yet. We may see the impact in the next few days when these results start to come back. So this particular graph is created to show the age and sex distribution of all these individuals in our community, and no surprises there. The gender difference is pretty much similar across all age group except the 80-plus population, where we can see more females are impacted. But we also know the overall life expectancy is higher in them. But for the rest of the age group, it's pretty much similar. The highest age group continues to be after 80 plus years is the between 50 to 59 years of age. And one of the questions that is frequently asked of us is the number of cases in each of the municipality. And this is the breakdown of these municipalities. But I would still say with caution that please do not take these cases as an indicator of which community is good or which community is bad, or if my community is safer or my community is worse. COVID-19 exists in all of these communities, and all of us need to take appropriate precaution to protect ourselves. When we are looking at this graph, no surprises, because majority of our population is live in the Windsor area, so we have most of these cases in Windsor area, but around the county, it is distributed pretty evenly. One of the municipalities, as you can see, has a high number of cases, and it's all because of the long-term care home in that municipality that is driving that increased number in that particular municipality. So when we are looking at the exposure history, because we are trying to identify how many of these cases are as a result of exposure to either travel or a contact of a confirmed case, or whether it was acquired in the community where we don't have any obvious cause of exposure. So as the travel piece is going down, initially the travel was the highest exposure that we were finding. Right now it has gone down to under 20 or 19%, and followed by a significant proportion of confirmed cases, going up to all the way to 34%. Still, almost a quarter of the case is community acquired, which is something that we want to reduce more and more with all our efforts at public health measures that we have put forward. The unknown 24% is still all the cases that are currently being investigated and being updated as we are getting the information. So looking further into the exposures and seeing the impact of where these cases are, and any particular group is more impacted by the other. What we can see here in this graph is around 30% of our cases in our community is in the healthcare worker. And among those healthcare workers, we can see in the graph, it's a stack bar graph, and it shows healthcare workers who travel to Michigan, and then the distribution of these cases in this healthcare worker. So majority of these cases, what we are seeing right now still is in like 30%, and we like to see that number going down. About 5% of these cases visited a healthcare facility anywhere, whether we're talking about in Windsor or whether we're talking about Michigan. So they visited a healthcare facility and then they got infected. Doesn't necessarily mean that they contracted it at the healthcare facility, but it just gives an indication that where they could potentially be exposed to this virus. So some of the risk factors that we are finding in these cases is what kind of chronic illness that they have. We looked at our data to answer this question, and this is what we can find. So roughly 20% of our cases had some kind of a chronic medical condition, or 17% to be exact. A small proportion of these individuals are also immunocompromised, 2% cases. And then we have the rest of the cases as a combined chronic medical condition, immunocompromised, which makes up 4% of our cases. 1% case is in pregnant women, and 35% of our cases has no chronic medical condition, and 40% cases we don't have that information, and we are still in the process of collecting that information. But majority of the cases, as we can see, is linked with do not have any chronic medical condition, and that is why when we are making those recommendations, it is for everyone. It's for young or old. It's for healthy or not. Everyone is at risk of contracting the disease, and everyone is developing the disease. So please follow the public health recommendations. Looking further on the risk factors, the most dominant risk factor is cardiovascular disease, no surprise, followed by asthma, obesity, and diabetes. This is not surprising for us because the local population health assessment data for 2019, which is also available on our website, has already identified the significantly high number of people who are overweight and obese and the cardiovascular disease as the leading cause of death in our region. And my message to all of the Windsor-Essex residents, as we are focused on the COVID-19 right now, we also need to watch out for some of our other health behaviors and pay attention to our health. Obesity, smoking, cardiovascular disease are a big concern in our community, and we need to work on it to become more healthy. A quick look at the cases and looking further on the risk factors, the most dominant risk factor is cardiovascular disease. Sorry, I already covered that part. My apologies. Okay, a quick look at the cases and what their symptoms are reporting. Roughly 3/4 of these cases are presented with cough. This is different from my last update when fever was the most predominant symptoms, and what we did is we cleaned up the data to make sure that we are not capturing anything twice, and also the impact of the long-term care home residents. Many of these long-term care home residents, the most predominant symptom that they're presenting is not fever, but instead cough. So that's why we can see some of the changes there. The 3/4 of these cases are presenting with cough, and followed by malaise, fatigue, headaches, and chills, which is pretty common in majority of these cases, and the numbers are presented right up there. One word of note that anyone can present with more than one symptoms, and that is why these numbers will not add up. So people may have multiple symptoms as they are presenting to us. So when we are looking at what is happening with all these cases, so now what we can see is roughly 40% of these cases are self-isolating and recovering at the comfort of their home. More than 20% of the cases, or 22% to be exact, are resolved or recovered. So that's a good news. Almost like 1/5 of our cases are resolving, and we are hoping in the coming days we'll continue to see an increase in those number of cases. On the flip side, unfortunately, we lost 6% of our cases, and less than 10% of these cases are currently in the hospital or ICU beds. Some of these cases are self-isolating and may have been admitted to the hospital, but right now they may be discharged and are getting better in the comfort of their home. And we are still investigating almost 1/4 of these cases in the community. So we're looking more focused on the deaths, the number of deaths that are happening, and is there any better way of explaining who these people are? So looking at the data, the split is pretty much even between male and female, 53% and 47%, and the majority of these deaths are happening in individuals who are 80 years and older, 66% of these deaths. 1/4 of these deaths happen in individuals between 70 and 79 years, and only one death, as we know, happened between the age of 40 to 49%. Just giving you a spectrum that any of these individuals, any of these people who contract COVID-19 are at risk. So please be mindful to take care of yourself and also your loved ones and also your community to prevent these deaths from happening in the first place. So this particular graph shows what it means for an individual who contracts COVID-19, and this graph is meant to show that all these cases that we have seen in our community and what is the current impact. In our community, the overall case fatality rate is 6%, which is pretty high. Those who are living in long-term care home, their rate is even higher, which is 10%, and that is why all the attention is now focused and shifted to that group. But even in the community, when we are looking, we have a case fatality rate of 3%, or a little over 3%, and it is important. It is a significant number that should motivate people to take appropriate precautions and take the steps that we are recommending for public health measures. And now the biggest question is always, where are we heading? Last time when I showed this graph, we were in the upward trajectory. With respect to the case doubling rates, our cases were doubling at the rate of slightly higher than 2 days now. But now we are, as we continue to see, we are almost touching to our goal of case doubling rate of 4%. Every 4 days. And we can truly appreciate that when we are looking at the graph, that it is showing some of the flattening effect that we talk about, that all these public health measures, all these public health action that is driving all these work with social distancing, physical distancing, case and contact management, putting all these measures, and people actually following those measures are paying it off. We can see that difference in the number of cases. Even though we are seeing those cases, we will continue to see some of these cases, but the message is whatever we are doing is working, and we need to continue to do what we are doing, because that's the only way we can get to a point when we can reduce the community transmission almost to zero, and then we can go back and start to talk about returning to our normal, whatever the normal looks like in the near future. So that concludes my part of the presentation, and I'm happy to take some questions from the media.
We'll now take questions from the media. We'll start with Blackburn.
Sorry, I'm still on mute. I guess that's just, we've seen a lot of comments about, not having enough tests to present a full and accurate picture of what is happening in the community. Maybe just touch on, I know we've touched on this before, but why is it not helpful, I guess, to test asymptomatic people in the community, more like widespread community testing?
So I've answered this question quite a few times, but let's just be very frank. What are we testing if we are testing asymptomatic people? Should we be testing everything that's possibly exists in the world? Because that's not, it cannot be done. If anyone who is symptomatic and who meets that criteria, which is pretty straightforward, and we have presented all this data, whatever we have, in what these people are exhibiting symptoms, there is a clinical assessment that is happening in all these centers. There is a clinical assessment happening with on the online assessment tool, and if they meet that criteria, they're going there and they're getting swabbed. So that's the number that we're talking about. Testing asymptomatic people, it doesn't give us anything unless we have that type of a resource that we are willing to invest. Right now, what we are seeing is people who are getting tested. And when we talk about the person positivity data, we showed that data. So if we are testing 100 people, and if the data is coming back positive for 5% or 10%, that's still pretty low. That means the cases in the community, it's not that high as many people suspect. And anyone who is asymptomatic, the likelihood that they will be spreading the disease is very, very low. And that's all I can say. But anyone who's symptomatic, I would strongly suggest that they should get tested. And to my understanding, they are getting tested.
Now, the 5% tests that are coming back positive, is that pretty typical for the province, or is that unknown at this time?
Well, to be honest, when we're looking at the validity of these tests and what this test should look like, the ideal test that we see should have a percent positivity of 50%. And then if we have a percent positivity of 50%, that means we are testing the right people. If we have the percent positivity of 5%, then that means basically we're not testing the right people, and people are still getting tested more than they should. And again, it's a complex science that would be hard for me to explain at this topic. But we like to see any test that we are conducting in the community anywhere between 30 to 50% positivity. Right now, we are seeing the positivity as low, which in some way is encouraging. But on the flip side, it could also mean that we are not testing the right people.
Thank you.
Any questions from the Windsor Star?
Is there any update on the conversations about testing and support strategies for people in the homeless population?
So all these activities are happening right now. Teresa is leading that from the health unit side and has been in contact with all the partners, including the city and the healthcare sector and the facilities that house these population. So we have a plan in place, and we're just waiting to finalize some of the key details, and then we will share that detail with the community in the next couple of days.
Thank you.
Any questions from Windsor?
We looked at the risk factors, the pre-existing conditions for cases. Do you have any of that data for the number of deaths that have occurred or the number of serious illness, hospitalized illness?
So we looked at that data. Most of these individuals have some kind of comorbid illness as well, but the data, the sample size is too low to draw any meaningful conclusions. So that's why we didn't present that data. But most of these individuals, just by the function of their age, after 70, almost all of them would have some kind of chronic illness, but not to pinpoint one particular chronic condition as the cause of these disease.
Any questions from CTV?
First, just in relation to the numbers, when it comes to outcomes, 26% not knowing the outcome of their results, like, is that alarming or concerning, or is that? So
26% unknown is basically are in the process of collecting data and presenting it back to the in our system. So it's not a concern. I think what I can say is these are the individuals either for the function of some of them are in long-term care homes. We don't exactly have data because we are unable to talk to them to collect all that information. So I wouldn't worry about that part. It is just as a function of getting delayed information on all those individuals.
And I can't believe I'm asking this, but what do you say to someone considering injecting disinfectant into themselves?
Absolutely no. I think that's there are lots of myths out there, and CDC has, I think, also produced some data that what is happening with people when they're bringing in groceries and cleaning their food with lots of chemicals, and basically they're exposed to all those chemicals and developing some of those complications. So please look at the science and look at the information. Do not read all those information that exist on the online, and follow the guidance. There is no evidence to show that food is one of the carrier or one of the things that people can consume and get infected by it. It's a respiratory infection. It has to be has to be a droplet infection coming across with people in that way, in that capacity. Food, we did a segment on that how do you clean especially the perishable items when you're bringing it back from your grocery store. Wash them properly with cold water. You don't need anything. You just wash it, rinse it, and then you store them in the fridge if you want to, and then you can consume it that way. And it's still it should be safe. And please do not use any kind of chemical, any kind of disinfectant on your food items or anywhere.
Any questions from CBC?
Yes, good morning. When you went over the numbers, women in their 80s were more cases of COVID than men in their 80s. Is there a particular reason for that? Is it that we just have more women in their 80s than men in their 80s?
I would say it's just because of the more women in the 80s age group compared to men. The life expectancy of women is higher than men, which is one of the reasons that you see more women in that age group.
Okay. We understand that the health unit has sent Dilkins a list of recommendations so that transit would be safe. Can you go over the list of things?
So that list will be finalized and will be posted on our website soon, so you can see that information as soon as we will post it.
Okay, thank you.
Any questions from Amy Huntred?
No, I'm good, thanks.
Any further questions from Blackburn?
No, I'm good.
Windsor Star?
I'm just seeing a lot of people online asking about antibody testing. Is it too early to even have that conversation? When or would it ever occur in this region?
So it's not too early to have this conversation, though. So that conversation is already happening. That testing is already happening. Public Health Ontario Lab is doing comparative analysis on the antibody testing and also looking at the swabs and do some comparative study to confirm the validity of those testing and how do you interpret those test results. We're expecting to see some results of that analysis soon, and we should have those numbers or testing available in our community. I think we have to be careful in how we will then use that test, because the sensitivity and specificity of these tests are high for the nasopharyngeal swabs rather than the antibody testing. Antibody testing can help with someone who has the disease, who had the disease in the past, and it may not be as accurate in the initial phase of the disease. It may be more accurate after the initial phase of the disease, and vice versa. The initial phase of the disease, NP swab is still the most sensitive to pick up the cases early.
Thank you.
Any further questions from Windsor?
I'm okay, thank you.
CTV?
Can people go recreation fishing this weekend?
So the question is, can people go recreational fishing? I think under the chief minister's, the premier's order, they cannot. I think it's not identified as something that's essential. I can still see people going on their own, not in an organized way, and I think there has to be some safety consideration, ensuring that they're maintaining their physical distancing, they're not congregating as per law of not more than 5 people, and still have to maintain their physical distance, and that's what it is. So as a general rule, it's not considered as an essential work at this time.
Any further questions from CBC?
I was wondering, you had mentioned pregnancy as one of the factors. For women who have to go to the hospital for checkups, is there anything they can do? Is there anything being worked around so that they aren't exposed?
So obviously, anyone who's visiting any of these healthcare facilities, there are process and steps in place to ensure that they are appropriately screened. And when they are at that facility, the appropriate infection prevention and control measures are in place to ensure the safety of anyone who is visiting these facilities. So it's not as a risk factor. It's the diagnosis that we presented that someone who developed COVID was also pregnant. So it's not a function of their pregnancy, but it's just a function of them contracting it. And as I said, the hospitals and the healthcare facilities, their infection prevention and control measures are there to prevent this from happening in the first place. So it doesn't really mean that they contracted it at the hospital. They could have contracted it somewhere else too.